the hepatitis flexure. So this is a new slide, which basically shows us the taxonomy of the hepatitis viruses. And basically, there are 4 of them that are RNA. They have an RNA genome, and that would be the hepatitis A, C, D, and E. Okay. And that means there's only one of them that has a DNA genome, which is the hepatitis B virus. So this is a good summary right here on this table or this PowerPoint. Okay. So remember, the only hepatitis virus that has a DNA genome is the hepatitis B virus. That B virus. Okay, let's start with hepatitis A virus. So hepatitis A virus is an RNA virus. It's an RNA virus. Actually, a positive single-strand RNA virus. Positive single-stranded RNA virus. It is naked, which means non-enveloped. Naked or non-enveloped. It has the capsid, the shape of the capsid is an isohedral shape. It has an isohedral shape. Remember that, as we said last week, that hepatitis A virus does not cause chronic liver disease, does not cause cirrhosis, nor does it cause hepatocellular carcinoma. The mode of transmission for hepatitis A virus is oral route, and therefore it is foodborne. It's foodborne, and it's prevalent in environments where there's improper hygiene. Okay, and it's foodborne. Okay. Remember, it's only going to cause acute presentation. Okay, acute presentation. So as we said, hepatitis A virus is a non-enveloped isohedral RNA virus with a positive single strand. Okay. So the mode of transmission, as we said, it's transmitted from contaminated food or water products, and it also can be transmitted by close contact with an infected person. It can also be transmitted by close contact with an infected person. So after oral inoculation, what the virus does is that it gets transported across the intestinal epithelium. Then it travels to the liver and enters hepatocytes, which are liver cells. Okay. Inside the hepatocytes, this is where the hepatitis A virus starts to replicate, and it will replicate within the cytoplasm of the hepatocyte cells. It replicates within the cytoplasm because this is an RNA virus, as we learned this week. And it does so by using an enzyme called RNA-dependent polymerase enzyme. RNA-dependent polymerase enzyme. Okay? So, the history and signs and symptoms of somebody who has hepatitis A virus. Okay, the history of the patient must include a recent, some type of risk factor. Okay, so what are the risk factors? It has to be the patient in an endemic area. Person have come into close contact with somebody else who has been infected. Okay, so for example, could be traveling to a high risk area. Okay, the symptoms are basically you get uh, abrupt onset of nausea, vomiting, and fever. Nausea, vomiting, and fever. Nausea, vomiting, and fever. Okay, abrupt onset of nausea, vomiting, and fever. They could have abdominal pain. Then, a few days after that, uh, patients will have dark urine, jaundice, and pruritus. Pruritus means itchy skin, itchy skin. Okay, itchy skin. This is a patient who has jaundice and has what we call scleral icterus, which means yellowing of the eyes. Scleral icterus, yellowing of the eyes. Again, this is a key signs and symptoms associated with hepatitis A virus infection. Okay, so the next one is hepatitis B virus. Hepatitis B virus. Hepatitis B virus, as we said, is a DNA virus. It's a DNA virus. It's enveloped. It's an enveloped virus. It's actually considered, the DNA is considered partially double-stranded DNA. Okay, partially double-stranded DNA that have and the DNA itself, it's actually circular. It has a circular shape. Okay, circular shape. Uh, the hepatitis B virus, as we said last time, is the one that can cause both acute and can cause chronic presentations. Okay. The mode of transmission of the hepatitis B virus is basically blood or sexual transmission. Blood or sexual transmission. Blood or sexual transmission. Blood sexual transmission. Okay. So, what are the risk factors for somebody to get infected with hepatitis B virus? Okay. First of all, perinatal exposure, okay, of an infant who is born to a hepatitis B virus infected mother. So that means this hepatitis B virus can travel through the placenta from the mother to the fetus. Okay. Another important risk factor is history of multiple sexual partners. Who have